Hi, I'm Paul Mayer. I'm the medical officer for Larimer County, and I wanted to record just a brief video with some recommendations for people who are high risk for severe COVID. I'll mention that the list of high-risk conditions gets changed all the time, and you should be aware that things like physical inactivity or your race are now added to that list. I would recommend you check that on the CDC website, or if you have any doubt, check with your primary care provider to see if you're one of those high-risk individuals. The first thing we want to emphasize for everybody is that the most important thing you can do to keep yourself from being hospitalized with coronavirus is to get vaccinated and to keep up with boosters. You're probably aware there is now a new booster available. People have asked us for a long time now if we thought that boosters would become a regular event for people, and it looks more and more like that's going to be the case. And so just to keep up to date with those boosters is the single most important thing you can do to keep yourself healthy. Number two is we would like you to have at home, ready to go, rapid testing for coronavirus. The tests are readily available at pharmacies, and the government has a program to provide them free. If you just go to covid.gov, you can get those mailed to your home. There's several reasons, but three main reasons we want you to have those at home. One is that, as you probably are aware, if there is another wave, they will disappear quickly from pharmacy shelves and they will no longer be available. Number two, if you have symptoms to suggest you have coronavirus and need a test, we don't want you to be out in public. We certainly don't want you to go to pharmacies to pick up those tests, because then you would spread coronavirus. And number three is that rapid treatment is crucial for these newer therapeutics. So to have those tests available so you can quickly test and get on treatment is very important. If you have a positive test at home, we want you to first call your primary care provider. If you don't have a primary care provider, then the hospitals have virtual urgent cares that are set up to manage this. And there is a federal program, Test to Treat, that's being rolled out, and we're hopeful that in the next few weeks that's going to become a reliable source of care as well. The other thing I wanted to communicate with people is that the order of the therapeutics is very important. The number one therapeutic that people should be taking right now is Paxlovid. It's a 2-pill regimen, it's 5 days. It does have to be started within 5 days of symptom onset. It's, in early studies, was shown to be about 89% effective at preventing hospitalization and death, so it is our most effective therapeutic. There are several drug-to-drug interactions, and so you do need to check with your primary care provider or your pharmacist to see if it's safe for you to take that medication. It is currently available. I have called several local pharmacies, and Paxlovid is available in our area, so that is the first therapeutic you should access. If for some reason you can't take Paxlovid, the next therapeutic to take is remdesivir. Remdesivir is not convenient. It's a 3-day course of IV infusions and would have to be arranged again by your primary care provider or with a medical visit. But it is the second most effective therapeutic we have. If for some reason you can't take those first two therapeutics, third on the list is monoclonal antibodies. It is frustrating for folks because the names change constantly, but just realize that infusion centers know the current guidelines. They will know which monoclonal antibody is right for the current variant in circulation. Currently, it's called bebtelovimab, but again, the names really don't matter. The last, and it is a distant fourth, is molnupiravir. That therapeutic is far less effective, only about 30% effective, actually. It has many reasons for concern, and it should not be being used in an area where there is good availability of the first three therapeutics. I should mention that the first three I mentioned are for people 12 and up and 40 kilograms and up. The molnupiravir, you have to be over age 18. We have seen some folks skipping from Paxlovid to molnupiravir as a therapeutic rather than using the remdesivir and the monoclonal antibodies, and that's partly what stimulated this video, is to remind people that the order of those therapeutics is quite important. Right now, we're in a new phase of the pandemic, and I am very happy that there are 4 therapeutics that I can talk about, and that's a move in a very positive direction for all of us. Thank you.